All right. Hello, world. Good morning. Welcome to Stonks Maxxing day. I don't even know what day is it anymore. 78? Okay. Day 178. Going over some flashcards in the morning before my friend comes later in the day. So I have two things. I have the actual industries, which I'm going to take a look at, healthcare here, and then also life sciences in my book section. So let's go here. Let's start. What is a rebate? Okay, this one is more so on the insurance and payment side. So rebate is typically a cash back of sorts. After you buy a product, you usually get some type of money back. Typically, these are negotiated on behalf of health insurance companies by pharmacy benefit managers, PBMs. Those companies are Aetna, I believe, by CVS, Optum, which is owned by United Health. Okay. The first ever approved ADC stands for antibody drug conjugate. When was it approved and what was it used for? Mylotarg. It was approved by the FDA in the year 2000, and it was owned at the time by Pfizer. It was used for acute myeloid leukemia, which is a form of white blood cell cancer. Annual sales of Keytruda from 2022 to 2024. I know in 2024 alone, this single drug brought in $29 billion. I don't know exactly how Keytruda works. That's actually something I want to ask ChatGPT then. Because I feel like we learned about Opdivo, which is Bristol Myers Squibb, and that was a checkpoint inhibitor. The checkpoint or the receptor was the PD-1, and that was on a T cell or some type of immune cell. If an antigen, a cancer cell, binds with that receptor, that PD-1 receptor, then the T cell is essentially nullified. It can't fight back. It can't even tell that this cancer cell is cancerous. It's not a real cell that belongs in our body. Okay, so let's do this. Is Keytruda also a checkpoint inhibitor? How does it work? But yeah, Keytruda 2022, I think 2023 was about $25 billion. So in just 1 year, you increase sales by $4 billion. That's almost 20%. Oh, wow. Okay. So why does Keytruda have much higher sales compared to Opdivo if they are essentially the same? Okay. There's probably some scientific details. Okay, interesting. 25 billion, okay. So 20 billion, 20.1 billion essentially. Okay. Just checking where my friend is. Okay, he's at Jersey City right now. Okay. Yep. So it went from 25% growth to about 20% growth. So see what happens, but pretty good. Break down what the term checkpoint inhibitor means. Please provide an example. So the term checkpoint inhibitor refers to the idea of a drug that inhibits some type of checkpoint from being completely nullified. I think another way to put it, an analogy, if you think of a zombie apocalypse and the zombies are bad things that are trying to take over your body, and you yourself have this armored vehicle, so you want to kill as many zombies as possible, but you want to also make sure that you're not running over a human, so to speak, because you don't want to kill real people, you just want to kill zombies. There's these receptors on at least I think there are these receptors on these T cells that kill other cells, harmful cells, that can help them detect whether or not it's a healthy or an unhealthy cell or a cancer cell. So that's the checkpoint. The checkpoint are the receptors that are important distinguishers or help the T cell distinguish between a cancer cell versus a non-cancer cell. And so with cancer cells, when they spread, sometimes they can nullify, they can target these receptors on the T cells that essentially inhibit them from attacking the cancer cells so they can grow. In a normally functioning T cell, they should kill the cancer cell because they can identify it and tell that it's not part of our body, and if it grows too much, we'll die. The checkpoint inhibitor will prevent cancer cells or any type of antigen from blocking these receptors, essentially stopping them from pressing the brakes on the T cells. And it can allow them to function normally, and it can help the T cells essentially kill the cancer cells. So examples of these are Opdivo, Keytruda, and probably some other ones I don't know about. Examples include Opdivo and Keytruda. So anti-CLA. So we can see here, this is our cancer cell, right? And it binds with these TCR, CD28, CTLA. And these are all receptors on this T cell. But if you have a drug that can create an antibody, maybe like a monoclonal antibody, which monoclonal just means that there's just one binding region for a specific type of receptor. There's also, I think, bispecific and trispecific. So you can target 3 or more receptors with a single antibody. But monoclonal just refers to the idea that an antibody can just target a single receptor. And then if that's the case, then it seems like what happens here is that T cell is still active. It sees that there's a cancer cell here that's bonding with it, and it's going to kill it. Okay, top selling drugs by revenue in 2024. Top 10 selling drugs by revenue. We have number 1, Keytruda. So that helps fight against various types of cancers, helps boost your immune system, essentially giving your T cells a supply drop, like in Call of Duty, a UAV, a kill streak, so that it can effectively kill cancer cells. That brought in about $29 billion. It's manufactured by Merck. Number 2, so this is where it gets kind of iffy because I don't know if the numbers on this list are completely right. I'd say it's a split between Biktarvy, which is the HIV drug manufactured by Gilead, Ozempic, which is the diabetes and weight loss drug manufactured by Novo Nordisk, maybe Mounjaro and Zepbound. I think it's the same formulation, tirzepatide, but they market it as Mounjaro, which is mostly a diabetes drug, but also marketed as a weight loss drug, and then Zepbound, which is fully marketed as a weight loss drug. So those are the big ones probably. I don't know the exact numbers behind them, at least 15 billion, 99% sure on that. I think individually Mounjaro and Zepbound are not within that 15 billion range though. And then you have Dupixent, which is a injectable manufactured by Sanofi for atopic dermatitis, which is the scientific name for eczema, and Skyrizi, which is manufactured by AbbVie, and that is to treat plaque psoriasis, which is another type of skin disease. I don't know how to describe it scientifically, but I think just using plain English, it looks like almost dragon scale like, or lizard skin like parts of your body that get super dry. It looks like it's pretty itchy. It could be painful. And then you have Eliquis, which is a blood clot anticoagulant by Pfizer and Bristol Myers Squibb. Opdivo by Bristol Myers Squibb, which is another checkpoint inhibitor. Humira, which is the rheumatoid arthritis drug manufactured by AbbVie. And then 2 more by Johnson & Johnson. I don't fully remember. Stelara, maybe, which is another plaque psoriasis. Oops. Let me see. Okay, so it seems like my screen froze. Let's take a look here. Oh my god, my hair is insane. Okay. Stelara, right, and then Darzalex. Okay. Darzalex, which is multiple myeloma. Don't fully understand what that is. Rheumatoid arthritis. Okay, Opdivo. There we go. So I'll put this as again. Oh shit. Annual sales of Keytruda from 2022 to 2024. So you saw 29 billion in 2024, about 25 billion in 2023, and 20.9 billion in 2022. Okay. $20.9. Top 10 selling drugs, the one I missed was Darzalex by Johnson & Johnson to treat multiple myeloma or myeloma. Don't fully understand what that is. Okay, so that's not bad for now. I'm gonna go to life sciences. So 3 books I have here: The Gene, Emperor of All Maladies. Those 2 are both by Siddhartha Mukherjee, which is a physician, a cancer physician, an oncologist that I believe worked at Massachusetts General Hospital and also maybe Columbia Hospital, and then also For Blood and Money by Nathan Vardy. Talked about that. Okay, so author of For Blood and Money, Nathan Vardy. He used to be a senior managing editor at Market Watch and also Forbes. Private equity, hedge funds, and biopharma. Okay, so pharmacyclics, the first clinical trial focused on type of drug, Texafrin, which is a molecule that helped improve the effects of radiation therapy. That was the goal. It was first introduced by this guy named Jonathan Sessler, who was a patient of Chris Miller, and the two of them, they were the ones that founded pharmacyclics. And together, they used this to try to treat glioblastoma, which was a cancer in the brain. Excitrin, okay. Effectiveness of radiation therapy. Who was Rudolf Virchow and what was his contribution to oncology? So Rudolf Virchow, same era as John Bennett, about 1865. So this is way, way back, at least 150 years back. So he was, I believe, a pathologist. And John Bennett at the time, he discovered some type of separation of the blood. Separation was a term to refer to whenever you have this congregation of white blood cells towards an infected region of your body. I think it's a natural immune response whenever you have these unwanted antigens in your body. So Rudolph, he was the one that coined the term leukemia. I exactly forgot what leukemia means. I think it's Latin or Greek for something. But he noticed that there wasn't really any separation of blood in his patient, who seemingly died of this silky smooth white type blood. And I think he used the term leukemia in order to actually describe this type of disease. Abnormal white cell. Rudolf Virchow was a German pathologist considered to be the father of modern pathology in the 1800s. He coined the term leukemia to describe the disease of abnormal white cell growth. Yeah. Oh, Sidney Farber. Okay, this is who I was thinking of. So Sidney Farber, I think he was the one that started the first chemotherapy-like therapies on cancer. I forgot exactly the molecule or the chemicals he used, but I know he was a pathologist. A pathologist is someone who just studies and is able to classify or identify and build a taxonomy of diseases. So they're essentially disease experts. He worked at a hospital in Massachusetts, I believe Boston, and he worked with children. There was some children that were dealing with cancer, specifically leukemia, and Sidney Farber, he helped treat these children using experimental drugs. Pathologists. Pediatric pathologist, known as the modern chemotherapy. Concept of separation in the medical world. So this is what I was talking about earlier. Separation is when you have some type of infected region in your body, maybe on the skin, maybe within an organ, maybe within some type of blood vessel. I don't know if that's true, but it's my best guess. So you have a congregation of white blood cells. You have this natural immune response to help fight off any type of antigen. Formation of pus. Yellowish white fluid that's a mixture caused by an infection. Okay. So I guess this is a more specifically it's the formation of pus. So that's something I ended up missing. It's the formation of pus, which is this yellowish white fluid of mixture, white blood cells, tissue, bacteria. Okay, got it. So who was John Bennett? What was his contribution to oncology? So John Bennett, he was another physician, I guess if you can call it that, pathologist in 1865. He was the one that first identified this idea of leukemia. He didn't coin the term leukemia. That was Rudolf Virchow. But John Bennett, he had a patient who died, and after he died, was able to see that his blood was very silky, it was very smooth, it had this white color, didn't feel like normal blood. And he thought it was a suppuration of blood, so it's essentially the buildup of pus within his body. And then Rudolf Virchow was the one that said, hey, maybe this isn't really what's going on. And I think what Rudolf Virchow saw was all of the organs seemed like they were fine. I think there was also something about the pancreas. I don't know exactly how the pancreas was involved, or even the liver. Could be something that filters out blood. I'm not entirely sure. 1845. Okay. So 1845, that was about 180 years ago, exactly. That's a while ago. Let me see where my friend is real quick. Okay, nice. He's almost here, so I might head out soon. Leukemia? So leukemia is a cancer in the what? It's like a white blood cell cancer. I think what it does, though, it doesn't... I should say this. So it's a cancer that involves the abnormal growth of white blood cells. And white blood cells are formed within our bone marrow. So I think it does affect the white blood cells themselves. So the B cells, the lymphocytes, T cells, most of our immune cells. And I think it probably also affects the bone marrow as well. Lymphatic systems that involves abnormal production. It affects all white blood cells. Okay. Original site of leukemia is in the bone marrow. Ooh, yeah. So, man, I wish I was not. I'm so glad I wasn't born in the 1800s. So the doctors back in these days, 180 years ago, 200 years ago, they did some crazy shit. I mean, to treat people with leukemia, to treat people with other diseases, they use leeches for bloodletting. So they take these blood-sucking parasites almost, put them on your body, have them suck away all your blood, and boom, you're good as new. There's also purging, which is the idea of just throwing a bunch of shit up, and hopefully after that, whatever disease you had in your body, it's in whatever bile you just threw up. But probably wasn't great ways to treat any type of disease. Yeah, this is not great. Ron Levy, what was his impact on cancer research? So Ron Levy, he was a mentor for Chris Miller, who went on to found Pharmacyclics. But Chris Miller and Ron Levy, they both founded IDEC Pharmaceuticals in 1985. And IDEC Pharmaceuticals created the first ever monoclonal antibody, rituximab. So this was also to treat leukemia, I believe, acute myeloid leukemia. I don't fully understand what the acute myeloid means, but that was, I believed, approved in 1991, the rituximab. And Ron Levy was also an oncologist at Stanford University. Okay, yeah, rituximab, first monoclonal antibody approved by the FDA to treat cancer. Okay. What did Rudolf Virchow think about John Bennett's theory of separation of blood? Yeah, he thought that it wasn't true. He didn't see any type of infection in the body. He saw that all parts, all the tissues, all the organs seemed perfectly normal. And I think something with the pancreas or enlarged spleen. Okay. So I don't know what the spleen is. Spleen, okay. This could be interesting. I don't know how leukemia affects the spleen though. What's the disease besides an infection? Okay. So who is Richard Miller? What is his background? Oh, was it Chris? Have I been saying Chris Miller this whole time, but his real name is Richard Miller? Ah, God. Okay. So it's Richard Miller, not Chris Miller. Chris Miller is the guy who created the Chip War book, not Richard Miller. So Richard Miller, he was a cancer researcher, a physician, an oncologist. His background started out at Stanford, then worked on IDEC Pharmaceuticals for about 6 years, and then started Pharmacyclics with Jonathan Sessler. And he helped develop, I believe, the first monoclonal antibody. So worked alongside Ron Levy, developed rituximab, and then using that success, started Pharmacyclics with Jonathan Sessler in 1991 to help build out clinical trials for Texafrin, or Excitrin, which was used to improve radiation therapy. That used this molecule to treat cancer. Eventually tried to capitalize their research by starting Pharmacyclics in 1985. So monoclonal antibody. Monoclonal antibody just refers to an antibody that targets a specific type of receptor. So monoclonal, I think mono just means that it's targeting a single one. It's just singular. And clonal, I believe, is something that's engineered from, let's say, a lab. It's not completely organic, or it's not like derived. It's probably derived from something organic, but it's not extracted from, let's say, a living organism or a plant or something like that. Okay. Takes them up to the CD20 protein on cancerous B cells. Totally forgot about that. So symbols. Derived from a single clone of immune cells. Okay, let's see. Alright, so it's 11:25, so I'm gonna have to head out for now. But thanks for tuning in, and I'll catch you guys in the next one. Peace.